Hello, my name is Nathaniel Collins. I'm the lead occupational advanced practice provider for the Occupational Health and Wellness Clinic and for the Convenient Cares. Today I hope to bring to you a brief tutorial that enhances your ability to recognize your roles within OSHA's respiratory standard in the evaluation and clearance of a worker's ability to use a respirator, specifically in terms of fit test or spirometry. In this video, I will review a few items. First, we'll go over the purpose of the exam or test type. Secondly, we'll recognize the exam, a fit test versus a spirometry test. Also, we'll review initial versus annual exams. And finally, we will review the OSHA forms, the Respiratory Medical Evaluation Questionnaire form, as well as the Respirator Questionnaire Review and Medical Evaluation Information form, which is also referred to as the clearance form. So let's review the purpose of these exam and testing procedures. First, fit testing. A fit test is used to determine the employee's ability to use a respirator within the workplace. Fit testing is the aspect that is completed initially and annually. Generally, this is where the employee will bring in his or her mask and will test to ensure appropriate fit and seal using a qualitative fit testing method. Spirometry is used to determine baseline pulmonary function and ongoing surveillance of a worker's ability to perform certain jobs in accordance with OSHA and MSHA standards as it pertains to silica, cotton dust, asbestos, mined earth minerals, coke oven emissions, benzene, cadmium, formaldehyde, and etc. A few specific jobs that fall within the area would be coal or quarry miners, steel or iron foundry workers, textile mill workers, maritime workers, specifically vessel fabricators. It is important to note that spirometry in occupational medicine is used as a screening tool, not a diagnostic tool. If an area is raised of concern doing a screening procedure, that employee is then referred to the appropriate provider or specialty. Now that we've reviewed the purpose, let's talk about the exam types, initial versus annual exams, or testing procedures, I should say. Fit test. The initial fit test begins with a medical exam. The Respiratory Protection Standard requires an initial medical evaluation to determine the employee's ability to use a respirator in the workplace. Secondly, you will review the OSHA Medical Questionnaire Evaluation Form. This is where you may or may not identify any medical history or information that may place that employee at risk for using a respirator in the workplace. Once that has all been cleared and you've determined that the employee can be fit tested, they will then proceed to a respiratory fit test procedure, which is a qualitative fit testing procedure. Once that is completed, you will review the information and then complete the provider determination page. Now on the annual fit testing procedure. Versus the initial, the annual fit testing procedure or visit does not begin with a medical evaluation. While OSHA has no specific requirement for annual medical evaluations, they may be prescribed to ensure that employee's ability to continue to safely wear that respirator in the workplace. So this annual visit will usually begin with a review of the OSHA Medical Questionnaire form, where you will again review medical history and any pertinent information that may or may not place that employee at risk for wearing a respirator in the workplace. Once this has been determined, that employee will then proceed to the respiratory fit test procedure, again a qualitative fit test procedure. And once that has been completed, the provider will complete the provider determination page. Once the spirometry test is completed, the technician will bring to you the results. As you can see, this is an example result that I have removed the patient information to give you kind of an example. A few things that you would focus in on is the patient's effort. If you notice, the machine here will give us an effort grade of A. That means that the test was completed and it is repeatable, which it also indicates. So the patient understood the test, they were able to do the procedure without fail, and you were able to get 3 readings, 1, 2, 3, that are repeatable and acceptable. So the machine does all of this work for you. So now your job is to take this information and to come up with an interpretation. So I've made this easy for you. So once you've looked at this, you will then obtain this form, which is the spirometry exam result form. I like to use my handy dandy ruler, which is a tongue depressor. I think we'll find in every clinic. Sometimes it's hard to find a ruler. First of all, I just want to point out that you'll notice on this form you'll have these different questions here. This may or may not be completed in your clinic, and the reason for this is because on the printout all of that information is there for you. You can see the effort, you can see the repeatability, and also if you flip over, the questions can be answered as well on the computer when they're performing the test. So all of this information can be completed at once and you won't have to double document. However, knowing that you don't have a full understanding of the interpretation and not everyone's NIOSH certified, this is an easy graph to give your interpretation. So first of all, let's take a look at this. If you look at the bottom of the graph, you will notice FVC. Also, looking up the side, you will see FVV1 or FVC percentage. So what we will do is we'll come to our results page and we'll identify up here to the top predicted, and we'll find our FVC come over. So our FVC predicted is 87.5. And then we will find our FEV1 FVC percentage and come all the way over to the percent predicted. This is what the employee produced. Of what they were predicted to do, this is what they did. So we will take those numbers. So first, the FVC. We find our FVC and we come over to about 87.5, so we're close to 90. And this is where I will use my ruler to place it up that chart just like that, about where I want it. And then my next number, which is going to be 90.9, again, that was the FEV1 FVC, and we see those numbers go up the side, and it's 90. And so I'll just look at the 90 mark, and then I can come across here and I plot it right here and just put a dot. If you would like to draw a line, that's fine, draw a line. You could do it as such. Where these two lines intersect gives you the result of the spirometry test. So as you notice, this says a normal, and I have them written in behind the graph for you to make it easy just to recognize, and that's the big thing that we want you to do, is to recognize the spirometry pattern. So now that we know it's a normal spirometry pattern, we can come back to this page and we can put this to the side, and we can see that just like in our EKGs, the machine will give you a generic diagnosis or interpretation. You can, and this one specifically says indicate a normal spirometry, or you could write normal spirometry pattern on the bottom and then sign it. And then this is where you would sign your name as such. Now that we've discussed fit testing and spirometry testing, initial versus annual visits, let me conclude by one important point. All workers falling under the OSHA and MSHA standard for high-risk exposure for areas such as asbestos workers, silica workers, miners, textile workers, foundry or melting place workers, vessel fabricators, and etc. must, I repeat, they must have a baseline chest x-ray on their initial exam. And then that chest x-ray is prescribed every 2 years periodically. However, that may be prescribed more frequently, such as every year, based on that employee's medical need for closer monitoring. All chest x-rays are then submitted for what we call or refer to as a B read. A B read is completed by a certified radiologist who is certified and trained to look for certain occupational hazards or diseases such as pulmonary fibrosis, lung cancer, mesothelioma, and other occupational health diseases.